University Hospital opened in 1972, and we didn't have transplantation as a separate discipline. I was chief of nephrology at that time, and the only organ we were transplanting, of course, was the kidney. So in March of that first year, we did our first kidney transplant. The rest of the country actually, though, saw us as the group, not me, the group, as very forward-thinking, in the sense that we were always asking the question, what observation here on the bench gives us an understanding at the bedside which will help us form the question that we can take back to the bench side again, and that iterative process, which is called translation, result in better patient outcome.
Innovation and triumph. No two words better represent the science of organ transplantation. London Health Sciences Centre has been a leader in transplantation since 1981. Two renowned LSHC surgeons have been pioneers of the program from the outset. Last December 24th, they were working together.
My name is Ken Knott. On Christmas Eve 2010, I had a heart and liver transplant at University Hospital. I was diagnosed with familial amyloidosis. It's a slowly progressing disease that leads to organ failure and ultimately death.
And the only option for that gentleman was to have a replacement of both organs, to have a heart transplant and to have a liver transplant at the same time. My name's Bill Wall, and I'm a transplant surgeon at London Health Sciences Centre.
My name is Dr. Neil McKenzie. I'm a heart surgeon at London Health Sciences Centre since 1977.
The surgery started late Christmas Eve morning.
The first stage is to do most of the heart transplant first, because for patients to get through a liver transplant, the heart has to be functioning well.
And continued into the night.
We connected him to the heart-lung machine for the heart portion of the operation, and having completed that, we used some of the same apparatus to partially bypass the liver to enable that operation to be completed, and that also went well. He was quite stable when he left the operating room, close to midnight on Christmas Eve.
Ken's success represents 3 decades of advancement in organ transplant. Advancements largely created by research. At LSHC, that research is done at the Matthew Mailing Center for Translational Transplant Studies.
The Matthew Mailing Center for Translational Transplantation Research is truly a unique model in Canada, and probably the world. Nowhere else are we going to have the consolidation of so many research scientists that are interested in solving the transplantation puzzle. Here we have 7 scientists that are focused entirely on transplantation. 2 of those are recent recruits, one from the University of Maryland, the other from Harvard University, that saw London, Ontario, the Matthew Mailing Center for Translational Transplantation Research, and London Health Sciences Centre as the leading place to do their research.
The Matthew Mailing Centre is critically important to advances in understanding better the rejection process and improving results that we have with organ transplantation.
That research isn't possible without philanthropy.
And much of that work relies on voluntary contribution from donors, and that has been critically important to the whole transplantation effort at this institution.
The development of the transplant program at University Hospital was absolutely dependent upon the donor of money for research, just as the actual transplantation of organs clinically was dependent upon an organ donor. The research today is a quantum leap from the kind of research we did back at the beginning. But to some extent, it is exactly the same in that we measure success in acceptance of organs, the health of the recipient, the lack of development of additional disease.
New dollars provided by donations to the center are going to further enhance this critical relationship between experimental investigation and clinical application.
Well, I'd love to have a time machine and go back to Banting's time when science was relatively cheap. But the reality is that big science requires investment of dollars. And there's no way that, in fact, we can solve any of the transplantation puzzles or questions without investment in the most sophisticated equipment and the best people. And so that's why fundraising is not only essential, it's absolutely critical to what we try to do at the Matthew Mailing Center.
What was missing back in those times was the kind of dynamic center that brought everybody together. Because it is that crowding together of people and ideas that result in discovery. And it's that discovery that gives the possibility for translation. And the Mailing Center is magic for the future of the transplant program at University Hospital. I'm so thankful for the patients, that the Mailing Center has been established.
So what does the future hold for us? It's actually an incredibly exciting time to be in the medical community here in London. You know, when we look at our education abilities, our research, the hospital structures, and the new leadership that's in place for that, if you look at what's coming to us in terms of an aging population, the healthcare issues that are going to have to be dealt with right away, we are perfectly poised now in London to be leaders in answering those questions, and we will be. This center is a critical component to that.
Well, the future, I hope, is brighter than what we have now. Although we've made many strides in transplantation, transplants aren't forever, and there are not enough donor organs for everybody. At some point, I'd like to say to a patient, we have a transplant for you, and that would be the end of their end-stage organ failure forever. And that's what we will try to do at the Matthew Mailing Center for Transplant Research.